As a doctor or nurse, what's the most obvious medical or health fact that you've had to explain to a patient? The most obvious yet tiptoed around fact is that everybody dies. Many years ago, I took care of a woman with end-stage emphysema. Her health had been in decline, and she was in and out of the hospital for the past several months. One day, her caretaker found her unconscious. Emergency medical personnel arrived and couldn't feel a pulse, so they resuscitated her. After a few days in the ICU, her condition was stabilized, but she never regained consciousness. The only living relative was a son who lived out of state. They didn't have a close relationship. The last time her son saw her was 2 Christmases before. Her son flew in and brought her advance directive, a document outlining her wishes and treatment preferences at the end of life. The advance directive stated, she would want to be kept alive for as long as possible. I pointed out to her son the document was dated over 12 years ago. Her health was not so bad then. I asked him what his best interpretation of her current wishes might have been. He said he had no idea. They rarely talked on the phone, and when they did, it was never about the end of life. Hence he insisted that we follow the directive to the letter. I explained to him that living as long as possible in her case would mean a lifetime of institutionalization, and being hooked up to a breathing machine 24/7 through a tracheostomy. She wouldn't be able to eat, speak, or communicate in a meaningful way. She would suffer many infections, pressure ulcers, issues with blood clots, and other complications along the way. And she will eventually die, I concluded. The last sentence surprised him the most. He said, "No, you don't understand. She wants to live. She has to live." To that, I asked him, "How do you think this will end?" He called me harsh and unprofessional. He refused to discuss the matter any further. He flew back home that evening and never saw her again.